Okay, well, thank you, Anusha, for the kind introduction and for organizing this fantastic event. Um, and my ambition is to give you an overview of the recent advancements that we made in tinnitus research. So, until a couple of years ago, there was a big controversy or a big discussion about what is actually tinnitus. And in 2020, we set up a task force, including researchers, patients, and patient organizations, to have a discussion about what is tinnitus now. And we came to the conclusion that tinnitus is the conscious awareness of a tonal or composite noise for which there is no identifiable corresponding external acoustic source. So people are hearing a sound that is not present in the environment. Hence, we also call it a phantom sound. And we classify tinnitus as chronic if a person perceives their tinnitus for more than 3 months. And tinnitus is seen as a symptom. And it's only when it is associated with emotional distress, cognitive dysfunction, or autonomic arousal that lead to behavioral changes or functional disability that we classify it as a tinnitus disorder. And this is helpful because the danger is if we do not have a good definition that we talk about tinnitus in a different way. And by establishing this task force and coming to an agreement, this is helpful to come to a consensus and that we talk about the same thing and that we're using the same language. Now, tinnitus is an umbrella term. And there's different types of tinnitus, and there's different etiologies related to the tinnitus. So you have pulsatile and non-pulsatile tinnitus. Pulsatile tinnitus is not very common. Only 4% of the people that live with tinnitus have a pulsatile tinnitus. And you know if you have pulsatile tinnitus, if basically it comes and goes, meaning that every time your heart is pumping blood to your brain, you hear a sound, a hissing sound, a roaring sound, or a pure tone, and that's classified as pulsatile tinnitus. But it can also be asynchronous to the pulse, and it can be more mechanical. It could be that there is specific muscle contractions within the middle ear that could cause tinnitus. But most of the people perceive what we call non-pulsatile tinnitus. And it can be the primary source or the secondary source. And the most common and most common cases, it is related to what we call hearing loss. It could be presbyacusis, which is age-related hearing loss, and we all have hearing loss the older that we get. That's a normal phenomenon. But it can also be because of a noise-induced hearing loss. Earwax implications could also be an issue, but it's a rare thing. And medication could also cause tinnitus. But the most common reason why people develop tinnitus is because of hearing-related issues. Now, if we look in Europe, we know that about 15% of the people in Europe perceive tinnitus. And what is intriguing is that it's different if you start looking at different countries. So in Ireland, it's about 9% of the people that perceive tinnitus, while, for example, in Bulgaria, it's up to 28%. And of course, it could be different depending on the study, but on average, we know that 50% of the people perceive tinnitus. And we also know that 6% of those tinnitus patients are really bothered by their tinnitus, and that 1% of the people that live with tinnitus are really suffering from their tinnitus. They will have severe tinnitus, and it's really disabling in the sense that they have depression, they have anxiety disorders, they have attention issues, they live in isolation, and so on. If we look at the health care resources, what we do know is that at least 6.8% of the people that live with tinnitus visit at least once a year their physician. And there's also a difference in depending in the income. Let's see here. So if we look at the GDP per capita, we see that the prevalence is higher in lower GDP type of countries in comparison to higher GDP related countries. Now, what we do see is that the older you get, the higher the risk you're going to develop tinnitus. the higher the risk that you're going to develop bothersome tinnitus, and that it can be severe, and that there are not that many sex differences. We see that tinnitus is as common in men as in women. But what we do know is that it has to do with hearing. And if we look at different age group, we see that hearing is increasing over time, and that the older you get, the more hearing, the more likely that you're going to develop hearing loss, and that goes together with also developing tinnitus. But it's not a one-to-one ratio, meaning that not everyone that's going to develop hearing loss is going to develop tinnitus. But there's a higher risk in developing tinnitus if you also develop hearing loss. And we know that there's an interaction between aging and hearing loss and the probability that you're going to develop tinnitus. But what is now causing the tinnitus or the chronic tinnitus? Well, we know that the brain is involved in creating this phantom percept. And if you look on the left side, what we do know is this is the auditory pathway. So this is the cochlea. This is where the sound is translated into an electrical signal that is sent to the brain. And what we do know is that there are different substations. And then in each of these substations, we see changes in people that experience tinnitus. In addition to that, we also know that there are different brain pathways involved in tinnitus. Now, we know that there's what we call a lateral pathway where the auditory cortex is involved. And the auditory cortex is basically a brain area that is translating the sound into a brain signal. And it's related to the loudness of the tinnitus. We know that this specific area is very active in people that perceive tinnitus. But there's also a medial pathway that has to do more with the bothersome of the tinnitus. And in addition to that, there's also a descending pathway that is more to do with canceling out information that you perceive from the external world. So the reason that you do not feel that you're wearing clothes is because the brain is canceling out that information. It's not relevant anymore for us that we're wearing clothes at some point. But it seems that in people that experience tinnitus, there could be a deficient canceling system that is not working properly. But why is this important that we really have a better understanding of how the brain is involved in tinnitus? When one of the big gaps that we have is that we have no objective marker for tinnitus. We have to relate and we have to ask the patient if they perceive their tinnitus. So people see it as a subjective experience because there's no way of objectifying if someone is perceiving tinnitus. But it's really important that we try to find a biomarker for tinnitus. And we think that we can find a biomarker looking into the brain. And why is it important that we have a biomarker? Well, it could create a paradigm shift in society and how people perceive their tinnitus. And it could also lead to more awareness about the disease. In addition to that, it could reduce one of the biggest frustrations of patients that they're not taken seriously. In addition to that, which is also important for the research and to get to a treatment for tinnitus, is that if we find an objective marker for tinnitus, it can help the pharmaceutical and hearing tech industry to start to invest in tinnitus, because then they can measure and see the changes that certain treatments could offer. The good news is that we got funding for that, and we set up a consortium involving people in the US, research in the US, as well as in Europe, to find an objective marker for tinnitus. And for the first time, there was a foundation that was willing to invest a lot of money to find an objective marker for tinnitus. And we're currently doing a study looking for that objective marker. But I think even more important is the treatment options. The thing is that if you go to a GP or to an ENT surgeon, we know that still most of the time that person is going to say, well, you need to learn to live with it. There's no treatment options. And actually, that's not completely true. We know that if tinnitus is the secondary source, there's a lot of potential treatments for the primary source. But in addition to that, you can also do something about the secondary source. If tinnitus is the primary source, there's also options. And this is basically giving you a summary of what is possible. Does it mean that we can eliminate the tinnitus at this point? At this point, we're not able to do that, unfortunately. But we can at least make it more bearable, the tinnitus, and to some extent also reduce the tinnitus percept, how loud you perceive the tinnitus. And there's a variety, there's a whole arsenal of potential treatments, going from psychological treatment to sound therapy, up to brain stimulation, up to certain drugs that could help with the tinnitus, and so on. So there's a variety, there's a whole arsenal of potential treatment options that are around. And currently, for example, I just did a search this morning, there's 37 clinical trials ongoing looking for treatment for tinnitus. So there's really people that invest their time in trying to find a cure for tinnitus. But one of the biggest problems is that we have all these treatment options, but we do not know what patient is helped with what type of treatment. So it's more of a trial and error approach. We could suggest psychological treatment. If that doesn't work, we could suggest a hearing aid, for example, or sound therapy, or we could go to pharmacological treatment. And if that doesn't work, we can go to brain stimulation. And at this point, we have no clue who's going to respond and who's not going to respond to a certain treatment. Now, there's a big fuss about artificial intelligence, but artificial intelligence could potentially help us also in trying to find out what patient is going to be helped with what type of treatment. And it's by integrating multiple studies into a specific analysis that could lead to a more personalized treatment and a more targeted treatment development. And because of AI, there's a lot of potential now in finding a solution and being able to predict who's going to respond and not respond to a specific treatment. Now, what are the challenges in doing tinnitus research? Well, if you look at tinnitus research in comparison to, for example, hearing research or diabetes, you will see that not a lot of funding is going into tinnitus research. It's really underserved in comparison to some other issues. And it's not specific to one country. It's all over the world. If you look at Europe, you will see that in every country, you see more or less the same thing. If you look at the US, in Europe, and so on, you will see that tinnitus research is not a priority for funding agencies to invest in this specific disorder. But the good thing is that more and more researchers are involved in trying to find a cure for tinnitus. This is a table that is showing basically over time, and the x-axis is showing basically the years, and this is the number of publications. And this is an indicator of how many people are actually investing their time trying to find a cure for tinnitus, or trying to better understand what tinnitus, how tinnitus is involved, of how the brain is involved in tinnitus. So it's encouraging that more and more people are interested in that. And Anusha is one example of these people that are really trying to invest and trying to understand and trying to find a cure for tinnitus. But what can we do? Well, creating more awareness. And I think this initiative that Anusha launched is one of the things. But there's many more things. So all of us could really talk about tinnitus and create more awareness to the public about what the issues are with tinnitus and why it's important that we do research on tinnitus and that we try to find a cure for tinnitus, because it's such a common problem. 50% of the population worldwide has tinnitus. What researchers need to do, and I think Irisima already addressed it to a certain point, is also training. So it's the role of the tinnitus researcher to also start training and increase knowledge about it, and also train medical doctors about the arsenal of treatments that we have. And for example, the tinnitus research in this initiative are trying to push this forward and are trying to basically do training, setting up training program and teaching about what do we know about tinnitus and what can we do about tinnitus. So, but what can we do in the meantime? What if you already have tinnitus? What can we do in the meantime? Well, I already suggested there are potential treatments, and I would recommend, if you haven't done this already, go to your GP and he can refer you to the right person. But we know that there also are specific things that we can do that not trigger, that basically reduce the trigger that your tinnitus is going to get louder. We know that sleep deprivation has an impact on your tinnitus. We know that anxiety and depression and stress has an impact on your tinnitus. And people that are distressed typically perceive the tinnitus louder than people that are more relaxed. So the exercise that Anusha introduced is actually to also reduce your tinnitus percept to a certain extent. Noise exposure has an impact on your tinnitus. There are some studies, not a lot, that suggest that weather changes and pollution could have an effect, and allergies could have an effect on your tinnitus. We also know that medication, that for example, certain antibiotics could have an impact on your tinnitus. And we know that head and neck traumas could also have an impact. Salty diets, high sugar diets could also have an impact. We know that blood pressure could potentially have an impact on the loudness of your tinnitus. And smoking, alcohol, and caffeine and recreational drugs, we know also have an impact on your tinnitus. So I hope you learned something more about tinnitus, and I thank you.